I welcome you all to yet another session of the Residence Corner module. These sessions are arranged by the Department of Neurosurgery at Liaquat National Hospital. Today we'll be discussing the white matter tract anatomy. Dr. Mubashra is first year resident at Liaquat National Hospital. Um, the idea behind these sessions is so that you guys can build 3D neuroanatomy, which is very eminent and important for any neurosurgeon.
So shall I start? So can you hear me? So can you hear me? So can you hear me?
Yes, I can. Yeah, yes, I can hear you.
So shall I start?
Yeah, please go ahead.
Assalamualaikum. Today we are discussing the white matter tracts. First, we will see why white is white and gray is gray. Gray matter basically has cell bodies of the neurons that first appears gray, and white matter is composed of mainly myelinated nerve fibers, which give them white color. The white matter of the cerebrum underlies the outer lamina of gray matter, intervenes between the cortical gray matter and the gray matter of the basal ganglia, in cases the ventricles. White matter has three types of fibers: association fibers interconnecting the different cortical region but of the same hemisphere. As in this picture, we can appreciate these blue color fibers are the association fibers. The second of fibers are commissural fibers interconnecting two hemispheres across the median plane, visible as a green color fibers in this picture. An example is of corpus callosum. Projection fibers passing up and down the neuraxis and connecting the cortex with caudal parts of the brain and the spinal cord, visible as a dark pink color. An example as the internal capsule. Now we will discuss the association fibers. Association fibers are of two types: short arcuate fibers which interconnect the adjacent gyri, and the long arcuate fibers that interconnect the widely separated gyri, which are clearly visible in this picture, which is a deeply dissected picture. We can appreciate these arcuate fibers. This is another closer view in which we can see these U-shaped fibers. Another fibers encountered in the ventricle margin is the stria terminalis, which is highlighted as a gray colored fibers. It arises in the amygdala and courses along the border of the caudate nucleus and the thalamus in the wall of the lateral ventricle. Now we are talking about the uncinate fasciculus, which is a hook-shaped bundle of fibers, connects the frontal and the temporal lobes located at the lateral edge of the anterior perforated substance. It has lower component and the upper component. Lower component connects the orbital surface of the frontal lobe with parahippocampal and other gyri on the medial surface of the temporal lobe. Upper component connects the gyri on the superior lateral part of the frontal lobe with lateral temporal gyri. This is the schematic representation of extensively dissected and a zoom view in which we can see the gray highlighted structure is the uncinate fasciculus, and other structures we can appreciate our anterior commissure, globus pallidus, corona radiata, head of choroid, and cingulum. When talking about the cingulum, it courses along the medial aspect of the cerebral hemisphere. It contains both long and the short association fibers that follow the curve of the cingulate gyrus, as we can see here. It interconnects the subcallosal and the para-olfactory areas on the isthmus of the cingulate sulcus and para-hippocampal gyri. Superior longitudinal fasciculus is located along the upper and the lateral border of the lentiform nuclei and insula, lateral to the internal capsule, connects the frontal, occipital, and the temporal lobe. Inferior longitudinal fasciculus courses near but separated from the walls of the temporal and the occipital horns by the optic radiation and the tapetum of the corpus callosum. Tapetum we will discuss in further slides. It connects the occipital and the temporal lobe. This is the lateral view in which the frontal, parietal, and the temporal opercula have been removed. Insula has been exposed. We can appreciate the corona radiata and some fibers of the internal capsule are fusing together above the insula, and superior longitudinal fasciculus is coursing around the outer margin of the insula and lentiform nucleus. Retrolenticular part of the optic radiations are exposed behind the insula and deep to the superior longitudinal fasciculus. And this is a further dissected view in which the claustrum and the posterior part of the external capsule has been removed, putamen is exposed, and the retrolenticular part of the optic radiation is exposed behind the lentiform, and the superior longitudinal fasciculus is courses superficial to the optic radiation and deep to the extreme and external capsule. Projection fibers. Projection fibers passes up and down the neural axis. Above the thalamus, they are arranged in the radiating pattern known as the corona radiata. These are the fanning out fibers, which are known as corona radiata. Internal capsule is a thick mass of white matter that is bounded laterally by the lentiform nucleus and medially by the choroid nucleus and the thalamus. It has 5 parts: anterior limb, posterior limb, genu, retrolenticular part, and the sublenticular part. Anterior limb is located between the lentiform nucleus laterally and medially the choroid nucleus. It connects the anterior and medial thalamus, pontine nuclei to the frontal lobe. Posterior limb located between the lentiform nucleus laterally and the thalamus medially. It connects the thalamus and cortex, corticospinal fibers to the motor nuclei of the upper and lower extremity and trunk. The fibers of the arm are near to the genu, and the precentral gyrus is positioned superficial to the posterior limb. Anterior and posterior limbs join at the genu. It contains thalamocortical fiber, corticothalamic fibers, and corticobulbar fibers to the motor nuclei of the cranial nerves. Retrolenticular fibers are in this. Some fibers of the internal capsule curve around the posterior edge of the lentiform nuclei and refer to the retrolenticular fibers. Some of the optic radiation pass through it. Sublenticular fibers pass below the lentiform nucleus, contains auditory radiation fibers from the medial geniculate body to the auditory area, and part of the optic radiation that courses from the lateral geniculate to the walls of the calca and sulcus. This is the lateral view in which we can see the lentiform nucleus has been removed to expose the internal capsule. Anterior limb courses between the choroid nucleus and lentiform and has a darker color as compared to the posterior limb, which we can appreciate slightly because of the transcapsular gray matter are crossing through the internal capsule. The posterior limb of the internal capsule is located lateral to the thalamus, and fibers of the internal capsule descend to form the cerebral peduncle, which is located medial to the optic tract. In this picture, we can clearly appreciate the darker color of the anterior limb and the posterior limb, which is a lighter in color. The retrolenticular part of the optic radiation has been removed. Tapetum is exposed, which separates the optic radiations from the ventricular wall. Retroepidermal wall of the atrium has been opened. Anterior commissure was transected and lateral part was removed. Middle part of the optic radiation has been elevated on this dissection. In this, we can see the sublenticular part of the optic radiations and auditory radiation pass laterally and separated from the temporal horn by the tapetum. Tapetum is way more clear in this picture, and the retrolenticular part of the internal capsule contains some of the optic radiations. Optic radiations. Optic radiations are separated from the roof of the lateral wall of the temporal horn and lateral wall by only a thin layer of the tapetal fibers. Optic radiations are divided into anterior, middle, and the posterior groups. Anterior fiber are the Meyer lobes subserve the upper half of the visual field. Middle fiber subserves the macula, and the posterior fiber are responsible for the lower visual field. This is a magnified view in which we can see the anterior one is a deeper and loop forward above the temporal horn before turning backward, and the middle one passes laterally above the temporal horn, and the posterior bundle passes backward lateral to the atrium and reach the calcarine sulcus. Commissural fibers interconnect the paired cerebral hemisphere. Corpus callosum. It is located between the hemisphere in the floor of the longitudinal fissure and the roof of the lateral ventricle. It has 5 parts, 2 anterior parts, genu and the rostrum, a central part body, and 2 posterior parts, splenum and the tapetum. Genu blends blue into the rostrum and continues caudally with the lamina terminalis. Genu gave rise to a large fiber tract, forceps minor, which forms the anterior wall of the frontal horn and interconnects the frontal lobe. Genu blends posteriorly into the mid portion, the body. Splenium gave rise to a large tract forceps major, which sweeps posteriorly to interconnect the occipital lobe. This is the magnified and extensively dissected schematic representation of a corpus callosum. Here we can see the genu is blending blue into the rostrum. This is the body, and this is thick part is the splenium, which gave rise to the forceps major, and the tapetum also arises from here. Other structures can be appreciated are anterior commissure, fornix, uncus, optic tracts, septum pellucidum, and the cingulum. Another fiber tract is a tapetum which arises in the posterior part of the body of the splenium and sweeps inferior laterally to form the roof and the lateral wall of the atrium and temporal and occipital horn. It separates the optic radiations from the temporal horn and the atrium. These yellow colored fibers are the tapetum, and these horizontal radiations are optic radiations, and this is the Meyer lobe. Anterior commissure is a small bundle that crosses the midline in front of the columns of the fornix. It forms the anterior wall of the third ventricle. It's shaped somewhat like the handlebars of a bicycle and interconnects the olfactory structures and temporal gyri on the both sides. Here we can see the dissection has been done, putamen is exposed, and we can see below the putamen this is the anterior commissure. And in the next picture, which is way more clear, and we can appreciate the handlebar shape of the anterior commissure. This is another schematic representation and the zoom view of the anterior commissure. Other structures are globus pallidus, head of choroid, cingulum. Fornix. Fornix is a main efferent pathway from the hippocampal formation. It contains both the commissural and the projection fibers. It is a C-shaped structure, and the fornix extend from the hippocampus to the mammillary bodies. It has 4 parts: fimbria, crus, body, and the column. It arises in the floor of the temporal horn and the ventricular surface of the hippocampus. Posteriorly, fimbria fused and blends to form the crust of the fornix. At the junction of atrium and the body of lateral ventricle, paired crura meets to form the body of the fornix, which passes above the thalamus and below the septum pellucidum in the lower part of the medial wall of the body of lateral ventricle. At the anterior margin of the thalamus, body of the fornix separates into two columns which arch along the superior and anterior margin of the foramen of Monro and blend into the wall of the third ventricle and descends down to reach the mammillary bodies. This is the dissected view in which we can appreciate these fimbria are coming and fusing with the crust, and it is ascending and crust are fusing to form the body of the fornix. This is another way in which the partially brain is dissected. This is the anterior aspect. This is the posterior aspect, frontal lobe, occipital lobe. Here we can appreciate this fimbria coming to the forming the crust. Crust are fusing, forming the body, descending. These are the columns and descended to join the mammillary body. Septum pellucidum. Septum pellucidum stretches across the interval between the anterior part of the corpus callosum and the body of fornix, composed of paired lamina and separates frontal horn and bodies of the lateral ventricle in the midline. In the frontal horn, septum pellucidum is attached to the rostrum of corpus callosum below, genu anteriorly, and the body above. In the body of lateral ventricle, septum is attached to the body of corpus callosum, as we discussed before, and the septum pellucidum disappears posteriorly where the body of fornix meets the splenium. There may be a cavity, the cavum septum pellucidum, in the midline between the lamina of septum pellucidum. This is a mid-sagittal view of a brain. This is the anterior part, frontal lobe, parietal lobe, occipital lobe. This is the fornix, this is corpus callosum, and this thin layer we can appreciate is the septum pellucidum. This is another dissected view where we can appreciate this corpus callosum and the thin layer of the septum pellucidum. Diffusion tensor imaging. It is an MRI technique that uses anisotropic diffusion to estimate the white matter organization of the brain. Fiber tectography is a 3D reconstruction technique to assess the neural tract and collecting data by diffusing tensor imaging. It is based on the measurement of the thermal Brownian motion of the white water molecules, as water molecules tend to diffuse more freely along the direction of the axonal fascicle rather than across them. Such directional dependence of the diffusivity is termed as anisotropy. The direction of maximum diffusivity along the white matter tract is projected in the final image. These tracts are color coded in fiber tectography. The colors are as mentioned. The red color are for transverse fibers, which are commissural fibers. This green color represents the anterior posterior fibers, which are association fibers. And this blue color represents the craniocaudal fiber, which are the projection fibers. But what are the clinical applications? We can use it in the assessment of the deformation of white matter tracts by tumor, either deviation, infiltration, or the destruction of white matter. Pre-surgical planning, early detection of Alzheimer's disease, focal cortical dysplasia, plaque assessment of multiple sclerosis, and early identification of musculoskeletal and peripheral nerve pathology.
Thank you, Dr. Mubashir, for this presentation.